You look much better in person.
Oh,
Much more talented.
an extra foot of bicep. Okay, well, one of the questions that we get all the time is, what about medicines after the surgery? And so one question is, gee, if I take antibiotics or some medicine, do I need to double up? Because I know this is a bypass, I know it affects digestion and absorption. Do I need to take more? And the answer is absolutely not, okay? Your dosage of medicines remains the same for most things. There might be a difference because you're losing an illness. So you might change your dosage of blood pressure medicine if your blood pressure goes away. You might change your dose of diabetic medicine if your diabetes goes away. But if you have a cold or you need some medicine, you usually take the same dose as you would pre-op. You don't double up. And let me explain why. The surgery is a bypass, and so it affects the digestion and absorption of some foods. But there are lots of things it doesn't affect. So for example, it doesn't affect the digestion and absorption of salt and water, because there's no extra work needed for your body to absorb salt and water. It's absorbed very easily, passively, across the lining of the gut. Fat and protein, for example, are very different. Fat and protein cannot be absorbed. You and I are water-based creatures, and as you know from making salad dressing, oil and water don't mix. So for us, when we eat fatty foods, we cannot absorb them unless we have help. And I'd like to explain how the miracle of fat digestion works by referring you back to the Dawn dishwashing liquid TV commercial. And so you remember that commercial where there's a greasy spaghetti plate gets dropped into the sink and bubbles of grease appear on the top of the sink water? And then to fix that, you see the Dawn dishwashing liquid come in and squirt, and the Aqua dishwashing detergent hits the water, and the fat globules dissolve and go away. Okay? You and I are fitted with our own Dawn dishwashing liquid dispenser. Instead of blue, though, ours is green, and it's called bile, and it comes from the gallbladder. So that when we eat fatty foods, to help us digest the fat, we squirt detergent, bile, into the gut, which helps us dissolve and absorb fat. In addition, the pancreas squirts out pancreatic enzymes called lipase that help digest fat. Now, when we do the surgery, we mess that digestive process up. But that's why you came to us in the first place. You were too good at digesting and absorbing fat in the first place, right? So when we do the bypass, we interfere with the normal digestive process for fat. And because of that, you don't digest fat as well and you lose weight. Good. Okay. Antibiotics and medicines do not require help for digestion and absorption. So you do not need to adjust any medicines based on having the bypass. Now you might be a different person. You might be thinner, for example. So for example, if you're taking estrogen pre-op or a diabetic medicine pre-op, oftentimes those have to be adjusted down because you're thinner and healthier post-op. So does that answer that question? Another common question about medicines is, you know, we have told you there's some medicines you should not take, right? Like aspirin and Motrin and Tylenol. Okay, why? Aspirin and Motrin, because they may cause ulcers. And Tylenol, because it can damage the liver. Okay, so many people will call me on the phone and say, Dr. Rutledge, I'm seeing my doctor about disease X, and he wants me to take drug Y. Can I take it? And I'll say, I don't know. Because there's so many drugs in the world, I don't know all the risks and benefits of all the different drugs. So I need to apologize to you, but ahead of time, here's what I recommend. In the future, if you see a doctor and your doctor says take a drug, you're welcome to call me, because I'll say hi and ask how you're doing and things like that, but I don't know everything about all these drugs. So the first thing I would do is ask your doctor and say, you're prescribing this drug, methotrexate or estrogen or some drug like that. What are its side effects? And remember, I have a mini-gastric bypass and I have a long-term risk of ulcers and liver problems, so tell me about this drug. Specifically, does it cause ulcers and does it affect the liver? Number one, ask your doctor. Number two, ask your pharmacist. That's what they deal. They deal in drugs every day, and you want to talk with them about that. I'm taking this medicine, Dr. X gave it to me. What are its risks? What are the side effects? What is the package insert? Can you interpret that for me? Does it cause ulcers, and does it affect the liver? Okay? And then third, we recommend you use the internet. In other words, go ahead and use the internet and type in drug X or Y on the internet and see what you can find. And of course, as I say, you're always welcome to call me, but there's so many medicines, so many drugs, that it's tough to keep up on all of them for me.
You know, my experience with her with that is Pat's been out for 4 years now, and she's had a variety of different small ailments, whatever, that she's had a surgery, everything else, and they've had no problem finding alternative drugs to match your requirements. So that's not she just scared of somebody. They know what my wife's surgery's been. Every doctor we've talked to has been told, okay, she said this, this, and that. And they've had alternative medicines that didn't affect her in any way, so that's not a problem at all.
Right. The things to remember are that the surgery, although it has many good features, has two big side effects that we worry about. One is long-term risk of getting ulcer at the junction, the connection between the stomach and the small bowel. There's a risk of getting an ulcer there. It happens that up to 5% of our patients will get some kind of nausea, upset stomach, or vomiting, or something like that, and we usually can fix that with antacids. We also can prevent it, in many cases, by avoiding things that are known to cause ulcers. So alcohol, cigarettes, aspirin, things like that you want to avoid. And there are things that can help prevent it by eating a healthy diet. And so a healthy diet includes fresh fruits and vegetables, citrus foods, oranges, grapefruits, things like that. Those are all healthy foods, and they should, as we've told you, be the foundation of your diet. So that's a great question, Zena. Thank you.
And what are the long-term problems with the liver?